What's up, everybody? Ron Placone here, reporting for Status Coup. So, this is a little different. I am normally not a hey, debate me, bro guy. That's usually not my style, but every rule's got an exception. I had a little bit of that recently with a guy named John Delaney. Now, you might remember John Delaney, you might not. He, by definition, ran for president in 2020. He spent about $24 million of his own money on his campaign. And for the most part, all he did was he had a few moments in the debates where he got dunked on. One of those times was by Liz Warren, who I believe didn't dunk on anybody else. And he managed to amass a social media following smaller than that of a comedian who streams from his bedroom and talks to a black cat. That's what John Delaney accomplished with $24 million. So that was his campaign. And every now and again, he tweets on Twitter. Sometimes I respond to it. And we got into it a little bit recently. It was something having to do with Social Security. He's actually against raising the age of Social Security, which I am too. But his reason didn't really make any sense. I pointed that out. He was apparently referencing some study that they're doing that. But yeah, anyway, it didn't really make sense. And here's where it started to get interesting. So we'll start here. He tells me that he'll pray for me. Now, I don't know what brought this on. Maybe he Googled me. He saw that I have an album called Agnostic Holiday. Sometimes people of faith will say that to people not of faith as sort of like a gotcha dunk attempt, like, ooh, I'm praying. Or they think maybe it'll offend us. I'm not sure. But I can only speak for myself. Such a thing doesn't offend me at all. My mom is one of the people I love most on this planet, and she prays for me every day, and she tells me about it. So I have nothing against prayer or anyone who prays. That's totally your thing, no problem. I just don't want it to be used as policy. That's where I think it's bad, and I pretty much told John just as much. I responded to him, and I actually said, thanks. Prayers are well and good. They're just not a healthcare plan. One of the many reasons why nobody voted for you, which is true. I thought we were probably going to be done there, but we were not done. John responded with this. It's too bad we can't have universal healthcare like the plan I or so many others have proposed. The universal healthcare movement has been hijacked by Medicare for All, a proposal that everyone knows will never happen, because it's bad policy in bad politics. So at this point, I'm a little tired of having a back and forth here. John got a little snarky with me. I got a little snarky with John. So I said, okay, fair enough, man. Let's talk it out. Let's have a debate. So I responded to John. I said, you really don't want to take the L here, do you? Tell you what, John, would love to set up a healthcare debate with you. Let me know a press email. We'll get that ball rolling. If I don't hear from you, hey, thanks for the prayers. Now, here's what John responded with. Always happy to debate people who know healthcare policy practices really well. So John will only debate certain types of people, and here's his list of experts here. Academicians, I always thought it was just academic, but I guess it's academicians, according to John, who study the field, healthcare professionals, administrative or policymakers. It's a complex ecosystem, 1/5 of our economy, and you need real expertise. Are you one of those? Now, I find it interesting, and I realize that there's a character limit on Twitter, but John's lists of expertise do not include journalists. They do not include nonprofits. They do not include doctors. They do not include activists. So interesting selection by John. But it just so happens that I check one of his boxes. I'm a former academic. I have a master's. I taught college. I'm published in some academic journals. I presented at multiple conferences, and I'm even in a few textbooks. I studied the rhetoric of social movements, and I studied the rhetoric of several things going on in contemporary politics, fracking, and healthcare being among them. So I responded to John, and I told him that, yeah, actually, I'm one of those things. I checked the academic box. I pointed out that's a kind of an elitist attitude, because it is. But it just so happens that, yes, I do check that box, specifically the academic one, so you in or out. John says it's not elitist. He goes on to talk about would you take advice on COVID from a doctor or not from a doctor, or building a rocket from an engineer, which by the way, that's a sentiment that on the surface I don't necessarily even disagree with, but it's not really applicable here. He's kind of moving the goalposts and just kind of just kind of dancing around things. So I respond to him again, and I say, don't move the goalposts. It's elitist to not be willing to discuss policy with people, especially if you seek public office as you have. And I was an academic. So again, he kind of just, mealy mouse around it again. Apparently, my expertise did not meet what John is looking for. So I instead went a different direction with this thread here. And I said, can you please explain to me how you are so much more qualified and an expert on healthcare policy than I am? You don't want to debate me. That's totally cool. But at least give a straight up answer. I didn't bring up specific policy, John. You did. So here's John's expertise. This is John's tweet. I spent 6 years running a healthcare receivable management company, helping over 500 healthcare providers manage their cash flow and payments. And then I spent 6 years in Congress, meeting with health policy experts and developing a detailed, comprehensive, universal healthcare plan. That's code for John was a glorified debt collector. John decided to use his business expertise, which I'm sure he does have business expertise. He strikes me as an intelligent guy, but he decided to use that acumen to get his slice of the pie of the predatory scam that we call a healthcare system. And basically, he collected money from sick people. John believes that not only that this is a noble line of work, but also that it makes him some kind of an expert, and other people are beneath him when it comes to talking healthcare policy. He is just so far ahead of things there based on his line of work. Now, I would disagree with that, Mr. Delaney. I think that there's two types of professions that are really holding us back as far as healthcare goes. Business people are one, politicians are another. You check both of those boxes. And I also want to remind you how things went for you in 2020. Can we pull up the Guardian headline, Colin? John Delaney draws 11 people to 2020 event. Does he truly think he can win? There were other events where John Delaney had a whopping total of 2 people, and a few others they cite in this article where he had a total of 15. Now, John, I'm not going to come down too hard on you here. I can tell you this. I have been a touring comedian for a very long time now. I definitely started at the very beginning, and I have played some rooms that have had less than 11 people, and there's a good chance I will in the future. I've never had a $24 million bump, though. I've definitely never had that. I'd be a little concerned if I had $24 million to help me fill a room, and I came out with 11 people. So I don't think debating anybody is beneath you, John. I really don't. And also, if you have some great idea that's some solution for universal health care, and it is so much superior to Medicare for all, well, not only do you apparently have a solution that's the gold standard for the United States, you have the gold standard that's the solution for the world, really. Keep in mind, pretty much every country in the industrialized world does a single payer or single payer adjacent plan. Even Switzerland, which does use the private insurance model, there's a lot of restrictions as to what those companies can do, and it's universal and gets everybody under the umbrella. So if you have a system that is so superior to what pretty much all of the industrialized world does, and keep in mind all those systems have better outcomes than we do and zero medical bankruptcies. If you have something that is so superior to all of that, wouldn't you want to share it? So I'll tell you what, I'll revamp my offer a little bit. Doesn't have to be a debate. If I had the performance you did in 2020, I'd be scared of anything with the word debate in it too. It can just be an interview. How about we just do an interview? We'll talk about healthcare policy. If you got such a golden ticket in your pocket, you should want to share it. So feel free to get in touch. We'll do it right here on Status Coup. It'll be an interview. I look forward to talking to you. And hey, politics aside, thanks for the prayers. I do appreciate it. Speaking of a few other quick announcements before I sign out here, folks. So the TikTok policy, there's a policy out there to ban TikTok. It has slithered out of committee, mostly on party lines. Now, as I mentioned on the show before, one of the big problems with this is that it messes with the Berman Amendments. What the Berman Amendments were is it's policy that allows the free flow of information from other countries to the United States. So imagine a scenario where any given president could decide what information you could or couldn't see from other countries and just censor anything foreign they feel like. So this is a pretty significant issue. It goes far beyond whether you use TikTok or not. Please go to don'tbantiktok.com now. That's don'tbantiktok.com now and sign this petition. That's don'tbantiktok.com, not don'tbantiktoknow.com. Don'tbantiktok.com. But go there now. Don'tbantiktok.com. And folks, I will be on the road. I got some tour dates. April 14th, my second show in Los Angeles, California. May 12th, third show in Los Angeles, California. I'm working on my Edinburgh Hour. June 16th, Madison, Wisconsin. June 17th, Minneapolis, Minnesota. June 29th, Chicago, Illinois. Use the promo code Lucy at checkout for discounted tickets for those shows. I got an early bird special going on. And Detroit. Mark your calendar, June 23rd. Tickets aren't available yet, but I will be in Detroit June 23rd. I will post more information as soon as it's available. And Edinburgh, Scotland, I'm going to be at the Fringe Festival, August 16th through 27th at the venue 32 Below, the Little Cellar. If you're going to be at the Edinburgh Fringe Festival, come to my show. It's 4 p.m. each day, August 16th through 27th. RonPlacone.com for all details and tickets. And this is Ron Placone for Status Coup, signing out.